If you're considering invisible hearing aids, you're probably asking yourself one important question. Am I actually a good candidate, or am I about to be disappointed? And that's the right question to ask, because invisible hearing aids can be incredible, but only for the right person. When they're chosen by someone who isn't a good fit, they often lead to poor clarity, constant adjustments, or frustration that makes people think hearing aids don't work at all. I'm Dr. Shana Stapleton, and in this video, I'm going to explain exactly who does and who does not do well with invisible in-canal hearing aids. Section 1. What invisible hearing aids actually are. When we talk about invisible hearing aids, we're referring to IIC hearing aids. These are placed deep inside the ear canal, designed to be hidden from view for most people. They're discreet, but that deep placement comes with very specific requirements and limitations, which is why they're not for everyone. Section 2. The number one requirement, hearing loss, type and degree. The most important factor in whether IIC hearing aids will work for you is your type and degree of hearing loss. Good candidates typically have relatively even hearing across pitches. Poor candidates often have sloping high-frequency hearing loss, especially when low frequencies are normal. Hearing loss that requires more power or advanced processing. Or poor word understanding scores, meaning the brain struggles to process speech clearly, even when sounds are loud enough. Because of their size, IIC hearing aids simply cannot provide the same power or features as larger devices, and pushing them beyond their limits reduces clarity. Section 3. Ear canal anatomy matters a lot. You can have the perfect hearing loss and still not be a good candidate. Why? Because ear canal size, length, and shape matter. Good candidates usually have enough canal length for deep placement, a canal shape that allows the device to sit securely, space for components without blocking sound or causing feedback. If the canal is too small, sharply curved, or narrow, invisible hearing aids may be uncomfortable, unstable, or visible. This is why IIC hearing aids should never be chosen blindly. Section 4. Custom versus non-custom invisible options. This is where a lot of confusion happens. Not all invisible hearing aids are the same. Non-custom invisible options. Some IIC devices are pre-shaped, limited in size options, not molded specifically to your ear. The main advantage of these non-custom options is convenience. Many are rechargeable rather than battery-powered. However, non-custom devices only work well for a very small group of people. Shift with jaw movement, allow more sound leakage, increase feedback risk, compromise sound quality. Custom IIC hearing aids, gold standard. Custom IIC hearing aids are made from an ear impression or digital scan of your ear. Their benefits include precise deep canal fit, better sound delivery, improved comfort, reduced feedback, greater stability during talking, chewing, or movement. Custom fit isn't about luxury. It's about physics, acoustics, and reliability. The trade-off is that most custom IICs use disposable batteries rather than being rechargeable. Section 5. Lifestyle and listening needs. IIC hearing aids work best for people who spend most time in quiet or moderately noisy settings, primarily want improvement in one-on-one conversations, not complex group settings. Value discretion over advanced features. They are not ideal if you struggle heavily in background noise or group conversation situations. Rely on Bluetooth streaming. Need advanced directional microphones. Smaller size always means trade-offs, and knowing that up front prevents disappointment. Section 6. Dexterity, vision, and daily handling. Because IIC hearing aids are small and sit deep in the ear, good finger dexterity matters. Good vision helps. Comfort with daily handling is important. If arthritis, tremor, or vision limitations are present, larger styles are often safer and easier. Section 7. Earwax and moisture, the hidden deal breaker. Invisible hearing aids sit exactly where earwax accumulates, moisture builds. Good candidates do not produce excessive earwax, can clean devices properly, use nightly drying systems. If earwax or moisture is a recurring issue, invisible hearing aids may struggle long term. Section 8. Who IIC hearing aids are best for. You're often a good candidate if you have mild to mild moderate, relatively flat hearing loss, have favorable ear canal anatomy, spend most of your time in quieter environments, want maximum discretion, are committed to care and maintenance. You're likely not a good candidate if you need strong performance in background noise. You rely heavily on Bluetooth streaming. You struggle with handling small devices. Section 9. A reality check about visibility, RIC versus IIC. Invisible hearing aids are about matching the right technology to the right ear and the right lifestyle. The best hearing aid is not the smallest one, it's the one you'll wear comfortably and hear well with every day. Here's something most people don't realize. For the majority of people, modern RIC hearing aids are effectively invisible in real life. Very small, tucked behind the ear, often hidden by hair, glasses, or the natural shape of the ear. Most people are far more aware of their own hearing aids than anyone else ever is. And here's the important part. With RIC hearing aids, you get better sound quality, more advanced noise processing, Bluetooth and phone streaming, rechargeable options, and far more flexibility as your hearing needs change, all without sacrificing discretion. To see which hearing aid style may actually work best for you, watch the next video.